An inquiry into how thousands of NHS patients became infected by contaminated blood in the 1970s and 80s is hearing evidence in Belfast. Around 5,000 people across the UK were infected with HIV and hepatitis C following the scandal, with some of those affected believing the extent of the contamination was covered up. Sky's health correspondent Paul Kelso is at the inquiry in Belfast, which is hearing evidence this week. What has been heard today, Paul?
Yeah, we've heard from more victims of this scandal, the contamination of blood that infected up to 5,000 people across the UK. There are around 100 people infected or affected by this still alive in Northern Ireland, and they are extremely grateful of the opportunity to give their evidence directly to the inquiry. It's moving around the country. It's had hearings in London, it's in Belfast, it'll go to Edinburgh and Cardiff and to Leeds in the north of England to hear directly from people. And this morning we've heard from two witnesses who gave their accounts. One, a woman who talked about the impact on her mother, who was infected with hepatitis C from a blood transfusion and has had 2 liver transplants with huge impact on herself and the extended family, but also from Simon Hamilton, a haemophiliac who was infected via a blood product, something to help his blood clot that gave him hepatitis C. He's chairman of Haemophilia Northern Ireland, and as well as talking about the impact on him personally, he made a strong address on the issue of financial support, which in Northern Ireland is less. There's less money paid to those affected than in other parts of the UK. He says the whole issue of how financial support is allotted has become muddled by devolution. The government announced before this inquiry that there'd be millions of pounds more in England to bring English sufferers, those affected, onto the same level as they were receiving in Scotland. But Mr Hamilton, addressing the inquiry, said Northern Ireland's at the back of the queue. This is what he had to say.
Responsibility means doing the right thing. And unfortunately, up until now, government has not done the right thing. And I think that reflects upon the last 40 years. It reflects upon the decisions of government not to address our problem. And while they refuse to address our problem, people die.
So clearly there a reference to the 40 years it has taken for, in the view of those affected, the government, successive governments, to face up to this issue. And as well as the issue of compensation, there is a wider desire expressed there by Mr Hamilton for justice and for the truth to come out. He himself was unaware that he'd received hepatitis C, that he'd been infected in this way for several years after his diagnosis. He believes he was being monitored to see the progress of the disease without his knowledge. That is quite a common story. And it's that quest for the truth about what happened that is going to follow in the second phase of this inquiry. This year we'll hear from the victims. Into next year, the corporate investigation into what public officials, the medical establishment and crucially ministers knew. That is the bit that those infected are looking forward to. Once they've told their stories, they want those responsible held to account.
Paul Kelso, thank you. And you can see more of that in an extended report, Blood Scandal, the search for truth, throughout the day here on Sky News.